Congressman Duffy, my name is Paul Miller. I'm from Eau Claire, Wisconsin. For nearly the last 50 years of my life that I've been working, 15% of my gross salary has been contributed to an escrow for the federal government to provide Social Security, Medicare, and Medicaid for those who are disabled, those who have to depend on health care after they retire, and for income after they retire. I'm asking you and the rest of the federal government to cease ever borrowing against it again and withholding these benefits from the American people who worked for it and contributed to it, and quit calling it an entitlement. We worked for it and earned it.
Congressman Duffy, you are my representative in Congress, but you do not represent me. My name is Sheila Johnson. I live in Shell Lake, Wisconsin. This is Layla. She lives there too, but she was born in France. I don't have prepared remarks. I have nothing but roiling anger and raw emotion. Last week, a colleague of mine was murdered in Kansas City, you might know him as Srinivas, and made some very apologetic remarks about the white terrorist that killed him, comparing that differently to Muslim Islamic terrorism, as if his widow feels his absence any differently. And it's that attitude of yours that stirs this hatred. I don't even recognize this country. I lived abroad for 8 years where Layla was born. Blessed enough to be in a civilized country with universal health care, and have come back here, and I just don't feel at home in this place where Wisconsin, the Wisconsin you are creating with your policies and legislation, has become a hateful and racist place. We are leaving in June. We are blessed enough and privileged enough to have the ability to leave a toxic environment that I won't raise my daughter in. I pray for all of you, and I will keep fighting until our plane goes.
Well, Congressman Duffy, I'm really sorry you couldn't make it to be here today. My name is Dan Hackney. I'm from Rice Lake. I'm your constituent. I also have personally gotten services from Planned Parenthood, and it was really important, and it wasn't an abortion, if you can believe that. Also, I wanted to make a request of you, if you would. Either just stop going on CNN or think about it before you open your mouth, because you're our representative. You represent us in the Congress with your votes, which is very important, but also you're kind of the face of northern Wisconsin. The rest of the country probably doesn't know many people from up here, and when you kind of make apologetic remarks for certain kinds of terrorism versus others, or you talk about how Donald Trump is popular with white men, whatever that comment was, it makes us all look kind of bad, and it's not going to be good for our tourism economy. And lastly, I've seen you talk a lot about the free market, and we need free market everything, especially in regards to healthcare. And I wanted to just make sure that you know that we have a mixed economy. The free market does some things very well, but it's really bad at other things. We don't have free market fire departments. We don't have free market police. We don't have free market army. We don't have free market snowplows. And I think healthcare is something that the free market has shown it doesn't do very well. So I just wanted you to keep that in mind. Thank you.
And would you please raise your hands if you believe that health care is a right? Thank you.
Congressman Duffy, my name is David Casino. I live in rural Barron. Before I talk about the issue I want to talk about, I just want to mention that I have 4 adult children. They've been out of the nest for a while, And since the Affordable Care Act was passed, all 4 of them have medical insurance, and that's something that makes me very happy. The issue that I want to talk about is our infrastructure. You just have to drive on roads. Our lock and dams on the navigation system were built in the 30s and basically never updated since. We lag in the world on public transportation. Our bridges, recent reports, and I'm sure you have more access to them than I did, are in terrible shape. We can see what's happening with city water systems, and Flint would be the worst example, but there's a lot more around. Much of our infrastructure is really crumbling, needing update or even replacement. And if you believe that building a wall is more important to infrastructure than the roads we drive on, or the water we drink, or any of the other infrastructure problems we have, I'm really sorry for you.
That was interesting, and all of us probably used the roads. We all probably used one to get here. What I'm wondering is how many of you would be interested in seeing mass transit in the United States improved?
Okay. My name is Edith Olson. I live in Rice Lake, and truthfully, I'm just plain scared. Our president is selling our country to Russia, and he's in charge of the button. And I wonder when I go to bed at night, what is going to be the condition of our country when I wake up in the morning. Now, Mr. Duffy, I believe you're a Christian. When you lived in the Ashland area, some of my friends sat near you in church. So I truly believe you're a Christian, but you have to care more about the people, not just the wealthy. The public schools need more money. We need Obamacare, and we need to think more about the poorer people. I can't believe what's happening, and it's very frightening. You need to do a better job, and you need to care about everybody. Thank you.
Hi, Representative Duffy. I'm Jim Chutchwart, and I was just peacefully sitting in this audience today, and then I got to thinking, I grew up in this country, in Wisconsin. My first grade teacher was the midwife for Gaylord Nelson. I loved that woman. She taught me to read. Gaylord Nelson was a friend. I really grew up thinking this state was pretty special. It was a progressive state. It had good roads, good school, and we cared about the environment. Since you and your kind of guys have been here, we don't do that anymore. I've gotten letters from you saying that the environment is less important than jobs, and you just have totally turned it around. I have had the luck to be in 50 countries in my life, and there's one of them that doesn't have health care for its people. And it's the one I'm standing in right now. You voted 20, 30, 40 times, how many ever times you voted, to cancel Obamacare. You had nowhere to go. What you would have given us is nothing, and 30 million people have lost their insurance. We don't know what's going to happen now. I hope you can sleep at night. I'm not a very religious man, but Jim Chutchwart tells you to read the Beatitudes. Thank you.
Congressman Duffy, my name is Judith Bender. I live in Glenwood City, Wisconsin. I've been a Wisconsinite for over 30 years. I knew you weren't going to be here today, so I have a letter in my hand that I will promptly put in the mail as we walk out the door today. And it says this: I am not a political activist, but with the health of our union and its citizens under fire, I feel it is time to stand up and express my displeasure with the present Congress's lack of what seems to be an understanding of the reality that those understanding of the reality of those who elected you. We are not all millionaires with unlimited resources, $100,000 plus lifetime pensions once we retire, and free health care for our families. These, the Congress has decided they deserve. But at this point, that is a totally different conversation. We work for a living and pay bills and try to give our families a good quality of life. I am presently most concerned about the debate on the affordability and access to health care for all citizens. I would submit to you that the problem lies without control over health care costs, exorbitant prescription drug prices, and greedy insurance companies. Get these under control, and everyone will be able to afford health care. I know that is a pipe dream, kind of like biting the hand that keeps you in office. But I would urge you to be a leader and make some real efforts to reform the present system. In the meantime, do not blame sick people for raising insurance costs and then pit the healthy against them. If I remember basic economics, the insurance companies base their premiums on charging premiums to all those insured, the not healthy and the healthy. So they then can use the monies they collect from both to pay all claims. No one knows when a disaster might strike a family, but they do happen, and in a country as great as ours, no one should have to declare bankruptcy because of medical bills and lack of insurance. We are better than that, or we should be. HSAs are great, if you can afford them. Many businesses have embraced this concept and it works well. But sadly, for many citizens living paycheck to paycheck, putting money into one is unreasonable. One size does not fit all. Perhaps being paid a living wage would someday allow this idea to become viable, but I doubt this will happen in my lifetime, given our capitalistic economy. One last item, which I should probably have addressed first: women's health care. It seems that some members of your party have decided that women are a health care burden and should be excluded from coverage for our needs or charged higher premiums. Denying a means for preventing a pregnancy, prenatal care, giving birth, and other health care requirements should be a part of every health care policy, not something extra to be added on with an exorbitant cost because we are women. Mr. Duffy, I challenge you to vote against the present health care bill and look for solutions that will ensure everyone. We will all require care at some time in our lives, and it is your responsibility to make sure it is affordable and available to everyone. That is what I expect from you and your colleagues in Congress. Thank you.
Ask you a leading question this time. Of course, I haven't done that before. How many of you would like to have the same coverage and the same insurance that Mr. Duffy has? That one.
I'd like to work the same amount and get paid.
Same amount.
Congressman Duffy, my name is Susan Hansen. I'm from Shell Lake, Wisconsin. I'm a constituent, but I'm also one of the people that you mock when you speak with your people about far left activists and worse words. Well, we people here aren't being paid to stand up for our country and to speak out for our fellow citizens. I'd like it if you would be here. I wish we had more than a cardboard cutout with a flannel shirt, since you are scheduled to be in this city right now, today, and for some reason couldn't be bothered to be here. I'd like to have asked you in person if you don't worry a little bit about Russia. I'm terrified about Russia. Every day we hear more and more and more damning information that goes higher and higher up of the people who knew about this and didn't tell or lied. Where are you on this? I've looked, I can't find comments. Are you standing up for citizens and for your own children? This is very dangerous. It's as if Russians dropped spies from the planes down into the Democratic headquarters and stole the files and the computers and took them in order to interfere in our election so that they could get the person they wanted for our president. Please, do something about this and tell us. Thank you.
Hi, Congressman Duffy. I tried to tell you that I like the Affordable Care Act at your town hall in New Richmond, where you actually were, and I met with limited success because you did not have a microphone for the audience to use. So I'm calling you out now. When you go to a town hall, you need to have a microphone and you need to hear your constituents out all the way through. We need to be able to be heard by the other people in the audience, and we need to be able to ask a follow-up question. Okay, and along that line, at that town hall, you said that you were in favor of seeing Donald Trump's taxes, and what you did was 24 hours later, you went back and voted for the only bill in the House that gave us any opportunity of pushing that forward. So where are you on transparency? I just got to call you out on your conduct, and my name is Barb Catt. I'm from Frederick, Wisconsin.
Hello, Congressman Duffy. I, too, am sad that you couldn't be here today. I wrote you a letter regarding my feelings on the Affordable Care Act, but I won't repeat those remarks here today. I want to echo what Mr. Dale Hansen said about climate change. I'm not a scientist, but I feel strongly, very strongly, based on my 40 years of experience as a person who has a garden and lives off the land, that climate change is here, and it's caused primarily by human activity relating to the use of fossil fuel. Did I say my name? Sandy Tomczyk, 2551, 15 1/4 Avenue, Rice Lake. I'm not a paid protester. As I said, I've observed these changes over a 40-year period. Spring comes at least 6 weeks earlier every year, and fall occurs at least 6 weeks later. We've had the mildest winter I can ever remember in my whole life. We have very unpredictable weather patterns. The last year we had a magnificent April or March or whatever it was, and the apple trees bloomed, and then we had a frost in May, and our apples were lost. We had nothing. I feel that these wild, unpredictable changes, which were predicted to happen by the climate scientists who have proven that this is occurring. I believe these changes are these unpredictable swings are going to occur more and more often. If left unchecked, it could mean the extinction of the human race. One thing we could do, one thing the Congress could do, Mr. Duffy, is to end all federal subsidies to the oil companies. This would result in more taxpayer money that could be used to fund health care, infrastructure, and other needs that we, the people, need. Thank you.
Would anybody here be interested in having him vote for a carbon tax?
Yes. There you go.